Hello, everybody. I think our numbers are slowly rising, and our expectation is there'll be a few people coming in as the meeting goes on. But it's noon time, and what we guarantee is an on-time performance to start today and an on-time performance at 1 p.m. Eastern time for us to close. But in the meantime, we're really excited about the next hour and the important message that we have to give. So good afternoon, good morning, good evening, depending on your time zones, everyone, and welcome to today's Association of Schools and Programs of Public Health webinar on the importance of voting and countering misinformation in public health. My name is Boris Lushniak. I'm honored to be the Dean of the School of Public Health at the University of Maryland in College Park, Maryland. Go Terps, fear the turtle. We're right outside the DC corridor, just within the Beltway system, and so therefore are really primed with the idea of what's going on in the world of politics around us, as we all are. I'm also currently serve as the Advocacy Advisory Committee for ASPPH as the chair of the advisory committee. It's an honor to be your moderator for today's session. As we approach the fall presidential election, today's discussion is more important than ever. We'll be exploring the critical connection between voting and public health. Voting and public health, right? We're really going to tie in the two for you, our listeners here today. And we'll be highlighting the ASPPH's Voting is Public Health campaign, discussing the significant impact of civic engagement in health on health outcomes. Our panelists will also share strategies for promoting voter participation and tackling misinformation during the election session and beyond. Before we begin, a few housekeeping notes. As everybody is used to right now, is if you aren't speaking, and the speakers will be speaking at some point, the rest of you will be asking you to share your questions through a Q&A function at any time during the webinar. But please turn off your microphones. Make sure they are muted during the presentations. We encourage you to submit questions during the Q&A function at any time during the webinar. We'll address as many of them as possible during our audience Q&A segment toward the end of the session. Now I'd like to introduce our panelists. And we are really proud, that's me, so I'm a panelist, not that important, but here's the real important people. Dr. Nora Moss is the Health and Democracy Coalition's advisor at the Institute for Responsive Government and Partnerships Director at Healthy Democracy, Healthy People. And she'll provide an overview of how her organizations are enhancing the civic health. Dr. Melinda Pettigrew is Dean of the University of Minnesota School of Public Health, and whose school is also a member of ASPPH, as is mine. And she'll be discussing the efforts of ASPPH members to promote civic engagement and its impact on community health. And finally, Dan Ivan, Senior Manager of Education Design at the News Literacy Project, will cover the challenges of misinformation and disinformation during election cycles. I'll also be sharing insights on ASPPH's Voting is Public Health Guide, a resource that underscores the importance of civic participation in shaping public health policies. So let's get started. And this is important, I think, for all of you. We now have 89 people. I think we have over 100 registered, so the numbers keep counting up. Those of you who have come on board late, I'm Boris Lushniak. I've just introduced the panelists. And right now we're going to be talking about this Voting is Public Health campaign from ASPPH. And I'm excited here today to be able to introduce ASPPH's Voting is Public Health Guide, an initiative that highlights the critical link between civic engagement and health outcomes. As public health professionals, understanding and promoting this connection is vital to our mission. And I dare say, as educators, to be able to educate our students about this is a critical piece of us as educators. The connection between voting and health. Voting is more than a civic duty. It directly influences public health policies that affect all of us. From healthcare access to environmental regulations and mental health services, the policies shaped by our votes and voices impact community well-being. Research shows that communities with higher voter turnout often see better health outcomes and greater equity. So what's the role of public health professionals in all this? Public health professionals have a unique position to advocate for voting. Our sector encompasses millions of workers dedicated to enhancing the public's health. By promoting civic engagement, we can drive policy changes that address social determinants of health, such as housing, education, and income, creating healthier environments for everyone. Now we get to this component. What are the actions that the organizations can take? ASPPH encourages organizations to foster voter-friendly environments. Key actions include hosting voter registration drives, implementing time off to vote policies, promoting participation as poll workers. These efforts empower communities to engage the electoral process, reinforcing the connection between democracy and public health. Next slide, please. Misinformation and voter suppression are significant threats to democracy, and we certainly see a lot of that around us right now. And I know, just as you, we all get frustrated with all this. Frustration is one thing, but how can we actually be activists to battle this, right? So as significant threats to democracy and public health, false information can erode trust in elections, and restrictive voting laws disproportionately impact marginalized groups. By educating our communities on spotting misinformation and advocating for voting rights, we can combat these challenges. Our guide offers resources to support civic engagement, including templates for newsletters, sample social media posts, and voter education tools. These resources are designed to help organizations and individuals spread the word about the importance of voting for public health. You see a QR code here. That'll get you to the program that's based out of ASPPH, Voting is Public Health, with all this information that's out there for your use. So in conclusion, voting is a public health issue. By advocating for increased voter participation, we help shape a healthier and more equitable society. So let's work together to make civic engagement a public health priority. Thank you for your commitment to this cause. You've probably already been activists out there in the field doing incredible things. By being here today, we hope that you become, in these last few weeks of an important election, all primed, ready to go, and ready to change the world around us. So now let's turn it over to our first speaker, Nora Moss of Healthy Democracy, Healthy People, and other titles that she has. Nora.
Thanks so much, Boris. Hi, everyone. My name is Nora Moss. I'm the Partnerships Director at Healthy Democracy, Healthy People, and the Health and Democracy Coalition's Advisor at the Institute for Responsive Government. Can we go to the next slide? Yeah, so I'm going to be talking a bit about the relationship between voter participation and health outcomes, why we're here today, why we care, and then a little bit about the Healthy Democracy, Healthy People Coalition and our work to promote nonpartisan civic and voter participation across the health sector. Next slide. So I'm sure we are all well familiar with this definition of public health, but I love repeating it at the beginning of all of my presentations because public health is what we do collectively to assure the conditions in which all people can be healthy. And so we're oftentimes talking about upstream policy level conditions that either enable our communities to thrive or hinder our communities from thriving. Healthy Democracy, Healthy People is a coalition dedicated to building our collective power to realize health and racial equity by strengthening democracy through inclusive civic and voter participation. Next slide. We see this relationship between health and democracy as interdependent. We know from research that when communities have higher civic and voter participation, we have greater power to influence policy, which then leads to the investments and policy systems that foster better health outcomes. And we also know that communities that have better health also have higher civic and voter participation, leading to a virtuous, reinforcing feedback loop. But we also know the opposite is true, that where communities have less civic and voter participation, we have lower levels of power to influence those same policies, leading to worse health outcomes. So Healthy Democracy, Healthy People was brought together in 2020, and we are a coalition of 11 national public health organizations. ASPPH is one of our founding coalition members, really has been a leading partner throughout our journey together. Next slide. So how is democracy related to health? Next slide. So you can think of it in this kind of framework where there are political decisions being made at every single level of governance. Next. And those political decisions, some of them mean that some communities have more influence and power over the systems and conditions in their communities. Next. Which lead to communities having opportunity. And those communities of opportunity oftentimes have better health. Next. And those same political decisions and that influence and power lead to more civic and voter participation. Next, which leads to a reinforcing feedback loop that we call representation in governing making spaces. Next. But we also know the opposite is true. Those same political decisions enable or hinder communities from having influence and power in that political space, which then leads to those same communities having less opportunities, worse health outcomes, and less civic and voter participation. Next, which then breaks that representation feedback loop, which further hinders our communities from being able to inform the political decisions that have an impact on our health and impact on our ability to participate in the political process. Next. And I want to be really clear, that these are intentional political decisions. They're not just ambiguous, happening by chance. These are intentional. People make decisions to pass policies and they disempower communities and reinforce inequities, right? It's not just by chance that we're making these decisions. Next slide. So we know this kind of framework exists from some historical examples. Wherever we've expanded the electoral power of our communities, we've seen health improvements. For example, the first example on this table is that when we enacted women's suffrage, when women gained the right to vote, we saw child mortality rates decline. And that was because women were able to effectively become a voting bloc, and legislative bodies actually realized that they had to be responsive to the concerns and needs of women, which led to investments in maternal and child health, leading to a long-term outcome of child mortality rates declining. And all of these steps forward on this table are steps forward, but we know that all of these steps have been contested and there is a continuous struggle for power at the community level. So we in public health can't sit out if we want to achieve our aims. Next slide. So in 2021, Healthy Democracy, Healthy People was looking at the literature and the evidence base for how health and democracy were interconnected. And what we saw at the time was historical examples and analysis like the ones I shared on my last slide, and international studies. But there hadn't been much research comparing health and voter policies in the United States in a contemporary example. And so we launched the Health and Democracy Index, which compares 12 public health indicators and the restrictiveness of voting policies in each state. And what was really clear is that states with more voting access and greater civic participation have better health outcomes. Next slide. And us in public health, we love to look at data. So here is our key finding graph. On the x-axis, we have voting policy. So on the left side, you'll see less voting access, states with less voting access. And on the right-hand side, we have more voting access. On the y-axis, we have health outcomes. This slide is showing better overall state health. And so states with better health are up at the top and states with worse health are at the bottom. And you can see almost a clear linear relationship where each of these boxes is a state, and states with less voting access tend to have worse health, while states with more voting access tend to have better health. And this research has been replicated in peer-reviewed journal articles. States where it's easier to vote are more likely to have better rates of self-reported health, lower uninsured rates and disparities related to insurance access, lower pre-vaccine COVID case and mortality rates at the county level. And we also know that civic engagement among adolescents and young adults is positively associated with better future income, education levels, and mental health compared to non-voters, which is really important for us that work with students every single day in our work. So what's the role of public health? Next slide. We have the opportunity to engage in systems change at every level, from the organizational level to the national level. At the organizational level, we can adopt policies to change that narrative and context for advocacy. I'm really excited to say that SOPHI, the American Medical Association, and the American Public Health Association passed policy statements in 2022, recognizing voting as an upstream determinant of health. State and local level systems change, we can join efforts and coalitions to explore policies that expand voting access, and we can incorporate measures of civic participation into our health goal settings. And at the national level, we can promote voter registration and participation using our health administrative levers like healthcare.gov, Healthy People 2030, and our national data dashboards like county health rankings and roadmaps. And so to share a few successes, I just want to highlight a few successes at the national level. We were able to get Healthy People 2030 to name increasing the proportion of voting age citizens who vote as a core objective of Healthy People. And they announced this change last summer in 2023. You can see on this slide that it's currently marked as getting worse. And so that should be a call to action to each of us that we must be continually working to increase civic and voter participation across our communities and hopefully change this tagline from getting worse to getting better. Next. Recently, we got healthcare.gov through a ton of community input and advocates sharing, resources and advice. We got healthcare.gov to add voter registration, a question about voter registration into the health insurance application process. Next slide. And at the state level, our coalition in Minnesota got the state health assessment to include civic participation in their 2022 recent state health assessment update. And you can see that even in Minnesota, where we have 61% of eligible voters voting in a midterm election, which is the highest in the country, we still have disparities across geography and racial ethnic groups. So it's really important that even where we have, some of the best voting policies, highest voter participation, that we're continually moving that bar forward on our policies that make it easier for folks to participate. Next slide. But what can you do? As an individual, we can always think about our own participation and think about how health is always on the ballot. So I invite everybody to make a voting plan for every election. Invite our colleagues, friends, and families to make a voting plan, promote opportunities for civic and voter participation in our workplaces and on our campuses, and invite our colleagues to learn more about this critical connection. Next slide. And Healthy Democracy, Healthy People this year is partnered with Civic Health Alliance and Vote ER, and we launched earlier in February the Thrive Through Civic Health We Will Vote initiative, which is an invitation to health organizations to serve as champions for nonpartisan civic and voter participation. Next slide. So why are we doing this? Well, like it was said earlier, we are 22 million workers nationwide, which is 14% of the US workforce. And 1 in 3 US eligible voters didn't cast a ballot in the last presidential election. What's even more concerning and surprising is that healthcare workers, including physicians, nurses, physician's assistants, and dentists, are 12 to 23% less likely to vote than the general population. So we have an opportunity to call ourselves in. Next slide. So we've offered an invitation to organizations and any of you who are thinking about campus involvement and being part of this kind of growing movement for health organizations to promote nonpartisan voter participation. I welcome you joining our initiative. Our commitment says just this. As leading health organizations, we commit to strengthening our democracy by encouraging nonpartisan voter participation across our memberships, employees, and affiliates. Next slide. And you won't be alone. I've highlighted and made the text a little bit bigger, but ASPPH is one of our founding partners of the We Will Vote initiative. And we already have a couple different schools of public health signed on. But we also have 85 national partners representing over 100 or 250,000 health professionals across the country. So I invite you all to join and to use ASPPH's tools and resources to promote nonpartisan civic and voter participation along with us. Next slide. And just as a final reminder, health is always on the ballot. It's on the ballot when we vote in ballot measures, local referendums, but it's also on the ballot in the folks that we task with representing us in every single governing body. So I want everyone to leave here with the reminder that we are always voting for health, even when we may not think we are. And so with that, I believe I will pass it over to Dean Pettigrew to talk a little bit about the School of Public Health Initiative.
Thank you. So as was mentioned, I'm Melinda Pettigrew, the Dean of the School of Public Health at the University of Minnesota. And next slide, I'd like to just reiterate some of the things that Nora and Boris mentioned in the relationship between promoting civic engagement and its impact on community health, because these are so absolutely important. And so as was mentioned, we talk a lot about upstream actions to stop diseases before they start and keep people healthy. And we're familiar with the social determinants of health, those social, political, environmental factors that drive health outcomes, education, housing, access to healthcare. But voting is a determinant of health, and political determinants of health help create the structural conditions and social drivers that really impact our health. And research, again, suggests that the relationship is bidirectional. People who are less healthy are less likely to vote, even after adjusting for factors that are also correlated with lower likelihood of civic engagement. And these might include lower income or education level. And civic engagement as a population level measure of how connected people are with their communities and to their elected officials has been linked to better population health outcomes. So if you think about both sides of these bidirectional relationships, then there are really important equity considerations that we need to keep front and center in terms of political participation. If people are in poor health and other forms of social marginalization do not participate in politics, there's that feedback loop that Nora spoke about that continues to perpetuate ill health. And also want to mention that research demonstrates that policies that are even ostensibly health related can boost voter turnout. For instance, the Medicaid expansions have been shown to increase turnout among low-income people in the states that have expanded. This demonstrates that interconnectedness between health policy, and political participation. Right, next slide, please. This is Goldie the gopher, our mascot. And I want to remind people that as much as national and presidential elections play a role in influencing change, it's critically important for people to stay informed and participate in their local elections, where you can really get to know your legislatures, you can support community health close to home. And one example of this that's been particularly salient over the past 2 years is this access to reproductive services. I'd also mentioned Medicaid expansion. So really think about those local elections, and they're very important. And as a reminder, voting protects every other right. Who you can vote for affects the funding that goes into housing, urban development. It can drive Medicare, Medicaid policies, SNAP, and a host of other social safety net programs. And one of the things that's so absolutely powerful about voting is that it provides a sense of agency. It empowers people. And I think about this a lot, being a dean of the School of Public Health. This isn't theoretical. It's not academic. It's not Ivy Tower. It's applied. It's action-oriented. It's something we can all do. So I'd like to go to, well, we're already here. So this next slide, to discuss how University of Minnesota and other schools of public health support voter engagement. So as a reminder, the University of Minnesota trains about 69% of the public health professionals in the state, and we have a very strong commitment to community engagement. So you've got photos of members of our team out in the community talking to people. These are folks doing do-it-yourself air filters to donate to members of the community. We're out at the Minnesota State Fair working on dental access and programs. And this is so important because relationships take time to develop, and these deep ties to the community can enhance trust. They promote health, and they provide opportunities to educate, collaborate, and also to combat misinformation in ways that advance health. And higher education equips individuals with the knowledge and skills that are necessary and important for civic engagement. So studies demonstrate that individuals with higher levels of education are more likely to participate in civic activities like voting, volunteering, and community organizing. And the University of Minnesota School of Public Health, like many other colleges and universities, actively promotes civic engagement. This can be done through service learning opportunities, community outreach, courses that focus on civic issues, and these all help reinforce connections between higher education and civic participation. And centrally at the University of Minnesota School of Public Health, we've been actively sharing university resources using the approach outlined in the ASPPH voting guide. We've been doing this across social media. I've been sending out dean's messages. We've been using other internal channels, and this work started really in earnest in early September. We've been promoting the civic engagement activities, specifically that Boris mentioned in the ASPPH voting guide, including the university's leave policies for civic duties, and these align with ASPPH's call for time off to vote policies. This facilitates student and staff participation in voting, and this removes some of the work constraints that many people may encounter. We provide voter resources and education. So we've got MVote, which provides comprehensive voter information, and it aligns with ASPPH's emphasis on campus-wide initiatives to boost awareness and voter turnout. And this mirrors ASPPH's approach to offering tools to help facilitate that informed voting that is so important. And we've got recognition as a voter-friendly campus. We've got efforts like the All-In Challenge. The university reflects ASPPH's suggestion for public health institutions to seek voter-friendly campus status, and we do. And this helps demonstrate our commitment. And one example of this is our partnership with Hennepin County and the city of Minneapolis. UMN will host an early voting site actually on campus in the university's Weissman Art Museum later this month. And then we do this work by linking voting to health. By promoting voting, we support ASPPH's view of voting as integral to public health, emphasizing the impact of civic engagement on health policy and equity. And as an example, our students, faculty, and staff help provide the evidence base for these relationships. For example, Sarah Gallas, our faculty member in health policy, has done a lot of work in this space examining how health status and health perceptions relate to political participation. Excuse me. She's shown how not smoking is associated with higher voter turnout, and how not having health insurance leads to lower turnout. I also want to add that we support this work, as I mentioned, through our service. As a school, we've really seen how research from our faculty and staff and subsequent work with the legislature can result in more inclusive public health policies. For example, Katie Cosimono's research and advocacy directly led to doula care being covered under Medicaid in Minnesota. And finally, the All-In Democracy Challenge empowers colleges and universities to achieve excellence in nonpartisan student democratic engagement. So in 1920, that's a long time ago. In 2020, this consistently comprehensive approach that the university has used has helped foster civic engagement, and it's led to the university receiving platinum status in the All-In Democracy Challenge. And this is the highest level of recognition by All-In. It's awarded to institutions with student voter participation rates of 80% or higher. And this designation highlights the university's successful efforts to encourage and facilitate student voting. And we're looking to similar results this year. So I'm going to hand it off to you, Dan, to talk a little bit more about misinformation and disinformation and what we can do about it. Thank you.
Thank you very much, Melinda and Nora, for those presentations. I learned a lot. And yes, I am Dan Ivan with the News Literacy Project. I'm the Senior Manager of Education Design. So yeah, before I get into that, I'll just speak a little bit about myself for a second. Next slide. I am the lead writer of the Rumor Guard, which is NLP's fact-checking adjacent site. And before that, I worked as a reporter for Snopes.com. The difference with Rumor Guard compared to a normal fact-checking site is we really want to teach people how to use these fact-checking skills. We just don't want to tell people what is true and what is false. We want to give them those skills for themselves. And that's the reason that I joined NLP, is that fact-checking work only gets us so far. It's great to have a resource to turn to look for accurate information. But what we really want to do is we want to teach people how to be better consumers of news when they are scrolling online. So one of the ways that we're doing that as the election approaches is with the News Literacy Project's election misinformation dashboard. Next slide, please. So I've been tracking misinformation for about the last year that has been related to the upcoming election. And all of that information can be found in this dashboard site that we've put together. And our goal here is really to help people see misinformation as broad trends instead of having them address them individual claims one by one. So we are collecting and cataloging examples of misinformation into this dashboard where we can tag it by their certain types or the certain narratives that they are spreading, so that people can see those patterns. Next slide. The three types of misinformation that we are cataloging are manipulated content, fabricated content, and tricks of context. These are really broad categories, and they are further broken down in the dashboard, but these are our parent categories. For manipulated content, that's a photograph that has been altered. For fabricated content, that would speak to AI-generated content, or even more commonly, just sheer assertions that have no basis in fact. And lastly, we have tricks of context, which are either misrepresentations of facts or taking photographs or videos and sharing them out of context. Next slide. So the dashboard has about 800 examples in it so far. And here's a breakdown of the sort of content that we've seen. Fabricated content and tricks of context are far and away the two largest categories ahead of manipulated content. And one of the reasons that I think that is that manipulated content takes work to create. It takes time and it takes effort. Where tricks of context is merely taking an old photograph and attaching a random sentence to it. In fabricated content, oh, can you hit the next slide? The other graphic didn't pop up, didn't appear. And fabricated content is also just a sheer assertion, which does not take any effort to create. So sheer assertions are the most popular tactic to spread election misinformation. These are just sentences that are conjured up out of whole cloth and spread online. And you can see in these examples, they're often accompanied by some urgency language or the language of journalists, like breaking news or scoop or just in, or language that's really meant to draw the attention of readers. But in all three of these examples, they are not followed up by any supporting evidence. So one of the things that we like to highlight is that this is a common tactic to spread misinformation. And if you can recognize that the next time you come across a tweet with a breaking news in the headline, but nothing that follows it, you can do a quick check of the source or a quick lateral search to see if it is supported by any evidence. Next slide. Here's a further breakdown of some of the tactics that are being used. And you can see on the right, the sheer assertions are outpace just about everything else. False context and false framed claims also make up a lot of these. And then we're going to get into AI-generated content in the next slide. So whenever I do one of these talks, AI generation, AI images, chat GTPs, those are always what people kind of want to hear more about. So I want to talk a little bit about how AI is impacting our elections. So before this election started, I think a lot of people, including myself, thought that we would be just awash with AI-generated images. And that's been true to an extent. It just hasn't been as overwhelming as anticipated. But it is certainly something that we need to keep an eye on. AI-generated images have been spread throughout the last months, especially over the last weekend or two with the hurricanes on the East Coast. Next slide. But they have not made up as much of the misinformation that we've seen. Can you click next slide again? It's not showing up. There we go. So it makes up about 6 or 7% of the total of all the misinformation examples that we've cataloged in the dashboard. So it is certainly making an impact. It's just not having as much of an impact as we may have expected. But with that being said, it has had kind of an interesting side effect. Next slide, please. The existence of AI-generated content is making it easier for people to cast doubt on genuine information. We have this claim here, which is a genuine photograph showing a crowd of people outside of Harris's plane, but it's being recaptioned and spread online as if it is an AI-generated photo. So it is this thing that is just sitting in the back of people's mind, and it's making it easier for people to create doubt. Next slide, please. Here is another example. This is a genuine photograph supposedly showing Tim Walz's family, showing their support for former President Trump. And this image is misleading a little bit on its own because these are distant relatives. But when it first went viral online, a lot of people tried to disprove it by claiming that it was AI generated. And it's not. It is a genuine photograph. Next slide, please. And we can see here too. This is a manipulated photograph that is being used to falsely claim that it's AI. The real photograph that was just taken after one of the assassination attempts on the former president showed Trump with his hand raised, and someone manipulated that photograph to show that he had 6 fingers, which is a common sign of AI generated content. So this is a manipulated image that is being shared as if it is evidence of AI generation, which is untrue. So next slide. Yeah, so that is kind of a brief overview of some of the election misinformation that we are seeing. And I will throw that back to Boris.
Great. Thank you so much, Dan. And thank you to all our panelists. We'll now have a time period where we'll have a discussion amongst the panelists and myself as moderator. At the same time, this queues up our listening audience, now up to 109 participants. So thank you all for taking time out of your busy days. But also, please generate questions in the Q&A portion. We'll see to when we get to the last 10 minutes of the presentation or so. We'd love to answer your questions as well. But let me first start off asking the group, and Melinda, you'll be the first to get this question. But in essence is, I ask each of you to reflect on how public health professionals can further engage communities in the voting process, especially as we're combating misinformation. I know, Melinda, you've done a lot over at the University of Minnesota. How is that interconnection between the communities that we serve in the academic centers? What ideas do you have in terms of making sure that we are doing our due diligence there?
Yeah, as I mentioned, we have a really strong focus on community participation, community engagement, and you really have to have these relationships established. You can't pop in and out. Establishing trust is so important. So we put a focus on long-standing, deep community ties. And this is through our research, this is through outreach and going to events and speaking to people. And once you have that trust, you can then pivot and really adapt and share these messages. We also try to focus on misinformation and combating disinformation in the public. And, so we send our faculty out, we ask them to speak to the news media. We provide media training so that they can speak at the level that people understand. So for example, we've got Rebecca Wirtz, she does talks about seasonal vaccines to highlight COVID-19 and flu vaccines and how you can get vaccinated and why they're so important. So it's really about educating and participating and getting out there and communicating. And so it's also critically important, which I already mentioned, is that it's really important that this information be accessible and at the level that people can understand.
Great, thank you, Melinda. Same question to you, Dan. What's your reflection on that? I know you provided some examples as well.
One of the things that we see is that there is such an effort to create distrust with these organizations. So it really is important. I know disinformation makes that all that much more difficult to build those relationships. And I think a lot of people have a hard time taking information from organizations as a whole. So building just personal connections with people is very important. And as Melinda said, making yourself available to reporters and to fact checkers Because when we address claims, we are not the experts, so we have to turn to experts to get information. So being available to give people information, so we can spread that to as many people as possible is very important.
Great, thanks, Dan. Nora, I was a little captivated and I must admit a little disappointed in the percentage that you gave us of health professionals who are actually voting. I'm not sure, is there a subset of public health professionals in that data set or not? But also, once you answer that question, it's, again, looking at your engagement in all this is how do we, continue to engage the communities in the voting process? Nora.
Yeah, so that study didn't have a separate, sub workforce for public health professionals. And I think that's because they use the current population survey, which I don't think actually has a tagline for public health. So hard to get down into that just for our workforce. I do think that though, the 22 million workers are all licensed health professionals. And so there's a ton of public health professionals that I can see that number being an undercount in the power that we have as a health sector kind of broadly. And I'd be really curious to see what the voter participation rates are for public health along with the other health professionals that may not be included in the study. I think though that when we think about our own participation and the participation of our own community members, the challenges are the same. The number one reason why people don't vote, and this includes health professionals and non-health professionals alike, is because they weren't registered or they had difficulty navigating the process. There are reports from organizations that do voter engagement work day in, day out. And what's really effective is when employers, nonprofits, and other community organizations give that nonpartisan messaging and detail around what are the voter registration deadlines in my state? What do I need to register to vote? And how can I register to vote? Can I vote absentee? How do I find that out and apply? Where and when can I vote? All of those kinds of nonpartisan messaging and reminders are welcome from our community members and from our employees, and they're often trusted when they come from trusted organizations. So I really want to encourage ourselves as, even in the academic setting, thinking of the power we have to influence our own health professionals in our network, and notice that could have some bleed down effect to the communities that we all work in day in and day out.
Great, thank you, Nora. And to our listeners, once again, pose your questions on the Q&A portion, but we'll continue with this moderated session until roughly 10 minutes to the hour. Then we'll go to questions from the audience. Dan, this one is for you specifically. Looking at misinformation, disinformation obviously pose significant challenges during the election cycle, particularly in shaping public perceptions about health policies. From your experience with the News Literacy Project, what are the most common types of misinformation you encounter, and how can public health professionals better equip themselves to combat these false narratives?
Yeah, so I think one of the most interesting things from collecting all these rumors is that the most common thing that we see are just lies. It's not a doctored photograph. It's not a AI generated image. It is just a statement that is posted without evidence. One of the things that we encourage people to do is break the habit of passively consuming news. We need people to be active news consumers. So just pausing and considering where a piece of content is coming from and what evidence is being presented aside it. It's really way too easy for us to just see something, accept it, and move on. I think something that health professionals can do is, because you are this source of trust for people, is use either NLP's resources or other resources to familiarize yourself with the sort of claims that are going around, so you can give people a better answer. You guys have the facts, but knowing where people are coming from when they, suggest that they've heard some policy change, gives you a leg up. You get yourself ahead of it and prepare yourself to answer those questions.
Great, thank you, Dan. This one's to you, Nora. Your work at the Health Democracy, Healthy People touches on the importance of storytelling. I always think that storytelling is a key component of public health education as well, right? There's so much we can do in the classroom, but in essence is how do we bring it to sort of real and real stories in particular? How can public health professionals use storytelling to connect with communities and drive voter participation?
Yeah, absolutely. Telling our own personal story is vitally important to increasing civic and voter participation and inspiring others to join us in a myriad of ways across, different issues that we may be talking about in public health. Telling a story about how something impacts us gets to an individual much better than data and analysis. And I know in public health, we love to look at charts, we love to look at graphs, we love to publish research studies. But to be really honest, I come from community organizing, and that's how I come into public health. The way we move people into action is really talking about our own story, being willing to be vulnerable and share, experiences that we've had in the community and why voting is important to us. And that's much more likely to get people interested, inspired, and then you meet them with the data and the analysis and the strategy so that people know that now that I'm inspired to do something, here's how I go about doing it. So I always highly, highly, highly recommend folks, add that personal touch, talk about why they care whenever talking about voting, because apathy is running rampant, especially when we're talking about national policies and national elections. And so personal stories can really go a long way.
Great, thank you, Nora. Before I get to Melinda's question, I'd like to just remind viewers that the Q's and A's are open, and we'll be going to them shortly. But in addition, Liz Mace, the incomparable Director of Communications and very well qualified, she's the one who got this team together ultimately, along with Beta and Tim Lashan, Beta and Tim from the advocacy side of the House ASPPH. We do thank our sponsors here today, ASPPH and all the participants, et cetera, et cetera. But Liz has been posting on the webinar chat important links. And so those of you who are on right now and want to look at some of those links or at least take a picture of them, they will be important sources of information. Melinda, you and I have a common bond, right? We're both deans of schools of public health. And one of our roles of deans is to make sure our students turn into activists. You talked a little bit about how do we get our students, and let's say put it out there, the communities that we're in charge of, faculty, staff, and students at schools of public health, to engage in the voting process. But with that fine line of not necessarily being partisan in what we do, right? How do we get people involved without necessarily, I always say a part of our role in schools of public health is to make sure our students, faculty, and staff are all thinkers. We don't want to tell them how to think, but how do we make them doers without telling them how to do?
Yeah, I mean, we do this through education and experiential learning, and it's rinse and repeat with a message, right? So we talk to them, we teach them about the legislature, we show them examples of how our research can definitely and directly lead to legislative action. We train our students in legislative advocacy. We familiarize them with the system. We have courses that teach them how to do this. We take them to the legislature and we show them examples of the faculty serving as content area experts to the legislature. And so it really has to go through this lens of providing them with the data and the evidence base and an understanding of how the system works, teaching them to be critical thinkers, and then we let them apply this information as they feel is appropriate.
Great, thank you, Melinda. Let's actually at this point go to one of our questions from our audience, and actually it's one of my faculty members, the incomparable and esteemed Dr. Stephen Thomas, who runs the Maryland Center for Health Equity here at the University of Maryland. We actually had a discussion about this earlier today, and there's an article, those of you who have not been following some of the news, in yesterday's Washington Post on the front page, talking about the issue of the DEI backlash, right? And in essence, questioning, aspects of people involved in DEI activities and not questioning both their competence, their professionalism, and the threat that comes with that. his question to us is racism was called a health threat. Then came the DEI backlash and a growing number of institutes exploring the nexus between racism and health, and their researchers are under attack per the article. And the question is, how does this potentially impact the issues we are discussing today? How do we bring in this as a concept in the political realm? Nora, how about to you on this?
Yeah. Honestly, I think that when we're doing something important, we should expect backlash. We should expect people to fight us. And I think that's true with naming racism as a public health crisis and the DEI backlash. And when we're doing work around voting at the intersection of health and democracy, right? We know democracy has been under attack and under threat with voter suppression tactics popping up across the country since before 2020, but definitely heightened since 2020. This isn't something new, but public health can't be afraid to do something because we're risking that backlash or anticipating that backlash if we know that the evidence is there and that it's important to act. And I think the evidence is there in terms of promoting nonpartisan civic and voter participation and pushing back against policies that suppress our communities from participating in the political process. And we have the tools and ability to do so. So I think it's really important that we step forward with a brave strategic step. And we expect to see this backlash, I think, but it shouldn't dissuade us from doing this really important work.
Great, thank you, Nora. We have another question from an anonymous attendee. What should public health students know about voting misinformation, and how can they be on the lookout for it, right? And yeah, I'll pose this to Dan because you've been really sort of pushing the point on this. But, as we talk about our students in particular, right, how do you teach this? I mean, part of it is what's real and what's not in this world, right? You showed us photographs, and I think to some extent photographs are simple, but you also talked about lies, right? Just out blatant lies. And the question is, are we obligated, or, is someone obligated? It's almost like that first debate, right? The fact checking part of it. Somebody is there telling, oh no, a yellow flag is thrown in the air, there's a foul. But how do we make sure people are on the alert, right? And specifically our students. Dan.
Yeah. When it comes to election misinformation, we're seeing a lot of the claims that we have seen before. The same rumors that circulated about 2020 are the same rumors that are going around about 2024. So having an interest in this and keeping up to date with the sort of false claims that are spreading can make them easier to spot. A lot of them are what we call zombie rumors, which are basically just rumors that come up, they get debunked, they come up again, they get debunked, and they just keep getting spread. There's an old propaganda saying of repeat a lie often enough and it becomes the truth. So from a news consumer perspective, we have to be aware that people are trying to create doubt in the integrity of our elections. They're trying to make it seem like our votes don't matter. They're trying to dissuade us from voting. It is incredibly important for us to develop critical thinking skills and take the time to examine this sort of content, because that's what the goal is. The goal is to stop people from voting, to be disinterested in politics, or to think that no matter what they do, no matter what vote they cast, that it doesn't matter. And it does. So really just taking the time to, if you are in doubt about something, there are tools that you can use to get that correct information. So people just need to spend that time to be active consumers of news, to make sure that they are getting their information from credible sources, and if they are unsure about claims, to try to check those against sources that they do trust.
Great, thank you, Dan. Next question from the audience is from Evelyn King, who also happens to be at the University of Maryland. I swear I didn't tell my faculty to all have to ask questions, but I'm happy that they're here and asking those questions. And this one will be to Melinda, and it touches upon a little bit of discussion we already had. But, Evelyn takes it from the perspective of being in the classroom, right? Us in academia, what are some tips for faculty, right? So this is really that small environment, right? A bunch of students. The faculty leader there is perhaps in an innate position of power, right? Avoiding coercion, disconnecting the message from course success. You know, you'll get an A if you vote. It's, you know, but how is it that in that intimate relationship of a classroom that we get a message across? Any tips that you have, Melinda?
Yeah, I mean, I think this is a question that I get a lot, and faculty are really hesitant to talk about it for the very reasons that were raised. I mean, I think one thing is to take a step back, and hopefully your university or the dean is providing resources, and you can leverage ASPPH resources. You can point them to university resources and do it that way. The main thing that we've been doing here, in addition to leveraging ASPPH's resources, is putting together a website. So we've compiled information for faculty, things like having difficult conversations, providing opportunities for role playing so that they can practice having these conversations. And I think as much as you can tie it to the content in the class and really keep it in the context of the information that you're teaching in a nonpartisan way, and then showing the students the evidence base, and then really allowing them to make their own decisions as opposed to you over interpreting for them. I think that helps. Faculty tend to be very afraid to even approach these topics because they're concerned about the implications. And so, you know, reinforcing that message that it's okay to talk about these things and just to be mindful of how. And I think Evelyn has taken the first step, right? Being mindful of that power imbalance. And I think just in thinking about that and being aware of that will help go a long way in, you know, getting that message across in a way that doesn't feel coercive.
Great, thank you, Melinda. Question from another anonymous attendee, and I'll hit you with this, Nora. I know we sort of, all of us have sort of touched upon this, but really is how can voting impact health, right? How do we get that message across in a succinct fashion?
Yeah, when we vote, we're voting to elect our governing systems from the local all the way up to the national level, and all of those folks make decisions that impact our health. And we're also at times voting on really explicit health policy when we see, you know, Medicaid funding, tobacco taxes, and others on our ballots as ballot measures. And so it's really important for us to see voting as part of the stream for changing the context for our health.
Great. I'm going to pose a question as both a participant and moderator to all three of you. So I recently had a trip. I gave a keynote address in Australia, and the Australians were very intrigued with what's going on here. Intrigued, a little bit frightened, you know, all those emotions were coming out. And yet they hit upon several aspects of the Australian system. One was voting is mandatory in Australia, right? You are fined if you don't vote. Secondly, voting is done on a Saturday and it becomes part of a neighborhood festival of sorts. Third is voting ballots are very simple, right? It isn't 3 pages of ballot measures, you know, et cetera, et cetera. And I was wondering, if you know, and I'll hit all three of you, if you can change one aspect of how we vote in America, what would you do? What would the ideal way for us to sort of deal with this? And Dan, why don't you start?
I love the idea of a voting holiday. Give everybody the time they need to actually go cast their ballots. There are definitely roadblocks that prevent people from voting, and removing as many of those roadblocks as we can would hopefully see voter turnout increase, which would be a wonderful thing.
Great. Nora, your thoughts?
Yeah, I think along with that, I would streamline the voter registration process. We're one of few countries that actually require our citizens to do predominantly all of the work when registering ourselves to vote. And it's the number one reason why people don't vote is because they're not registered. And so I think there's ways we can streamline that process and put the ownership of registering our eligible voters onto the systems and governing processes that already collect all of that information every single day from us.
Great. Melinda, thoughts?
Yeah, I would agree with both of those. I think if I have to pick one, I think the time off for voting is going to be absolutely key. I don't know how that would structurally work in practice, but I think it sends an important message that this is an important thing that we all have to do. And so giving people the time, you know, we're putting our words into actions if we do that and say, you know, we're giving you the time off to vote because this is absolutely critical.
Great. Thank you all. We're into our last minute, and I promise on-time performance for all you busy people out there. I'd like to thank all our speakers and attendees for joining us today. Your participation is vital as we work together to promote what? To promote civic engagement and address misinformation in public health. Please keep an eye out for follow-up materials, and remember that the recording of this session will be available on our website in a few days. ASPPH has at least one ASPPH Presents webinar a month, so don't forget to check out the schedule for it. The QR code is displayed, as is the code for the ASPPH voting guide. And so the next session is going to be what the U.S. presidential election outcome means for public health. Notice it'll be done post-election, and hopefully we'll have results at that stage. Thank you, and have a wonderful rest of your week, and be sure to vote next month. Thank you so much for your attention here today.
Thanks, everyone.